professor in computer science and engineering, data science department of Godavari Global University, Rajahmundry, Andhra Pradesh. She's a doctorate in computer science. She has 25 years of experience in the field of education, and she has started her journey of UHV in 2020. So I welcome Shrija Maguji. Welcome, Guru. Over to you.
Thank you, ma'am. Thank you for the introduction. Once again, good evening to all, and welcome to all the panelists who are present here. I warmly welcome all the delegates and the other participants who have joined here through various channels. So today is the third day of our 3-day panel discussion on holistic human health. On day one, we explored about the SWOT analysis of the health of the youth and the healthcare system. On day two, we saw about the proposal for vision for holistic health. And today we have joined again for the third day, where we'll be discussing about the practical aspects of implementation of this vision for holistic human health. So before we move on, for all the delegates who have joined here, I would like to introduce our panelists. Firstly, let me introduce Dr. Sundar Raj Permal sir. Sir is a distinguished Ayurveda physician and specialist in Panchakarma with over 20 years of clinical experience. He serves as the director of the Arogya Dhatri Ayurveda Research Institute in Visakhapatnam, which operates a 40-bedded hospital integrating Ayurveda and yoga for traditional treatments of chronic diseases. Academically, he holds an MD in Ayurveda and MSc in psychology. Dr. Perumal plays significant national roles, including serving as the national co-coordinator for the AICT Health Syllabus Committee. As a dedicated educator, he has organized numerous health exhibitions, medical camps, and conducted 29 free 7-day residential Ayurveda Swastha Vritika practical training workshops. Welcome, sir. Welcome for this session on third day. Next, I would like to introduce Dr. Amipara Manilalji. Sir brings a rare combination of industrial innovation and academic leadership with over 2 decades in R&D, global project experience across Japan, UK, and Africa, followed by 17 years in academia, culminating as principal of an engineering college. Welcome, sir. Next, I would like to introduce Dr. R. Sujata. Ma'am is Principal and Associate Professor of Computer Science at Subbalakshmi Lakshmipati College of Science. Her extensive career focuses on high-impact research, practice, and education in network security, a field she began exploring with her doctoral thesis. Holding a PhD in computer science, she has accumulated over 27 years of experience at the UG and PG level. Her leadership has been recognized with the Academic Leadership Award and the Best Administrator Award for the academic year 21-22 and 23-24 at her college. Additionally, she has authored several textbooks covering diverse topics such as green computing, blockchain and cryptocurrency, and value education. Welcome, ma'am. Dr. Vidya ma'am is there. I'm not able to see her. So let me introduce now our next panelist, Mr. Nilanjan Datta sir. Sir is a faculty member of Operation Theatre Technology currently working at Medhavi Skills University. He is highly decorated academically, having received a gold medal for securing the first rank in both his BSc in Operation Theatre and Anesthesia Technology and his MSc in Anesthesia Technology from SRM Medical College Hospital and Research Center. He has relevant clinical experience, having completed a one-year clinical internship at SRM Medical College Hospital and Research Center. Mr. Datta aims to leverage his clinical knowledge and passion for education to create a stimulating learning environment. He is committed to delivering comprehensive lectures and practical sessions teaching skills such as anesthesia equipment management, troubleshooting, and cardiopulmonary resuscitation, CPR. Welcome, sir. Welcome to this session. Next, I would like to introduce Mr. Swapan Chanana, sir. Sir is a seasoned educator with 25 years at PCT Group of Institutes, Ludhiana, where he also serves as Director of Students' Welfare, passionately teaching universal human values to students of management, engineering, and computer science. Welcome, sir. Next, I would like to introduce Aditi Parekh. Aditi Parekh holds academic qualifications like BA, BSc in Biology and Diploma in Naturopathy and Yoga Therapy. And she is into UHV, attending the sessions from last 2 years. Welcome, Aditi. Next, I would like to introduce our student panelists. Uh, Two of them are present here, Kriti Sharma and Shobit Raj. Both of them are second year medical students at SRM Medical College, and they are also following UHV for the last 2 years. Welcome to both of you, Kriti and Shobit. So once again, I would like to welcome all our panelists. Now, before diving into the discussion, I would like to quickly share the format of this panel discussion. So the entire session is structured for 90 minutes, and this will start with a 20-minute briefing from the proposal on implementation steps for the holistic vision of health, which will be the topic of the discussion today. And the discussion will be with the panelists is scheduled for 1 or 2 rounds, with each panelist allocated 4 minutes per response to the questions asked to them. And we all will be able to notice a clock at the top right corner of the screen. We'll be hearing a bell if the time exceeds for our response. So I request all the panelists to keep the responses focused so that we can cover as much as possible. After the 90 minutes discussion, we'll be having a 10-minute open forum for welcoming the question answer session from the delegates. And after that, I'll formally close the forum for the day with a brief summary of our discussion. So I request all the panelists to keep the videos on for the entire session. So once again, today is the third day of our panel discussion, where we'll be seeing about the implementation of value-based holistic human health. So let us now share so I'll be giving a briefing of around 20 minutes. So ma'am, can you share the screen?
The screen is already on. Is it visible?
Yes, ma'am. So today is the day 3 of holistic human health discussion. So it is on implementation of value-driven holistic human health for youth. So next slide, please. So just to give a quick summary of the various proposals that we saw yesterday. So we had a discussion about 2 different proposals. One is the current approach, which is the body-centric approach, And second one is the proposed approach, that is the holistic approach. So when we look at this body-centric approach, the human being here is seen only as body. And when it comes to the health of the body, there is a huge rely on the laboratory tests for early detection of diseases. And there is so much dependency on medicine and treatment for the diseases. And sometimes these medicines are taken for lifelong also. And there are so many unanswered questions, concerns regarding the actual cure and the root cause of these diseases. Whereas in the proposed holistic approach, the human being is seen as a coexistence of self and body. And we can see the health of the self is the given first priority. If a healthy self takes the natural responsibility for nurturing, protecting, and rightly utilizing the body, this will help in promoting a healthy body. For the health of the body, there is a proposed program for staying healthy, and that has got 4 different steps like intake, routine, that is the lifestyle, labor and exercise, followed by postures for regulating internal and external body organs and regulated breathing. So this is the first approach or the first step we can say. And later on, followed by medicine and treatment if at all the body goes into kind of any disharmony. And later on, the health can also be ensured. If a healthy self is there, a healthy self can ensure uh, health in the family, society, nature. Overall, altogether, we can call it as the health of the environment. So this is the proposed holistic approach. Next slide. So just to give a sum up, what we mean by this holistic perspective, the proposed holistic perspective on human health. So here we can see it is in 3 steps that we are proposing it. First is the mental health or the health of the self, where understanding the human being, understanding the self, followed by which leads to harmony in the self. And this, we are calling it as a healthy self. So this is our first priority. Second is physical health or the health of the body, where we lay stress on understanding the body, which leads to harmony in the body. And this is what we are referring to as a healthy body. And this is healthy body is at the second priority level. First priority is for the healthy self. Second is for the healthy body, followed by the conditions for mental and physical health, which we are referring to as the health of the environment. So understanding the environment, which includes understanding the environment, harmony in the family, society, and harmony in the nature and existence as a whole. So this we are referring to it as healthy environment. So this is in the third priority. So healthy self, followed by healthy body, and finally a healthy environment. And understanding the self, its relationship, its role as a human being in harmony with the body, family, society, nature, and existence. The individual lives according to it, starting with taking responsibility of the body, and finally the feeling of love and compassion. So this is the proposed holistic approach for the human health. So next slide, please, Didi. So this proposed approach, the implementation, which is the topic for today's discussion. So implementation of the holistic vision for health, the way forward, we are proposing this in 4 different levels. First is more research is required as far as the self is concerned, or which we are referring to as consciousness. Second thing, what can be done is sensitizing workshops on UHV and holistic human health in academia, in education for faculty and students. Third approach that can be followed is UHV and holistic human health courses can be introduced in academia for the students. And lastly, we are proposing the development of holistic centers of well-being, which can work on integrated approach, integrating different streams together. Next slide, please. So let us see the first approach that we are going to propose here. That's the implementation in health education. First thing what we are proposing is preparation of the faculty. For preparing the faculty, some FDPs can be organized, and FDPs can be done on universal human values, where the objective will be holistic human world vision. Introductory UHV FDP on universal human values, a 3-day or a 5-day face-to-face or online workshops can be conducted. And UHV2 FDP on universal human values, 5-day face-to-face or 6 days online, it can be done. Secondly, we can do FDPs on holistic human health, uh, where the objective will be the responsibility and competence to stay healthy. Introductory Holistic Human Health 1, FDP for 5 days, online or face-to-face can be conducted with the objective of holistic understanding, where we can uh, go with the self and body-centric approach rather than only following the body-centric approach. Universal health principles based on reality can also be taken care of. Recommendations can be given regarding the holistic health. Then self-observation and self-exploration exercises, where understanding the self and body by direct observation can be done, which we are already doing through our morning sessions. Every day morning, 5:30 to 7:30 in English and Hindi. And finally, tracking one's progress in health through the health tracker, that can also be done. So these are the two different FDPs for the preparation of faculty. Next slide, please. So next is implementation in education. So in the last slide, we saw what can be done for faculty members. Next, we are going to see what can be done for the students. So implementation in education, courses for students, 1 semester course, a 3 credit course can be introduced. UHV and holistic human health courses for students as an add-on in the main syllabi can be done, where UHV1 will deal with introduction to universal human values. It's the part of, it can be done as a part of the student induction program. Secondly, UHV2 foundation course in human values and professional ethics, understanding harmony and ethical human conduct. This can be done as UHV2 course. UHV 7A, a foundation course in holistic human health, its philosophy and practice. So these are the UHV courses that can be done for the students. Eventually, holistic value-based education and inclusion of the self in research and evidence-based medicine. So this is what we are aiming to implement through education. Next slide, please. So in the next level, what we are proposing is implementation in health maintenance through counseling and wellness centers. So holistic centers of well-being in providing an integrative approach to well-being of all, in addition to the current system of medicine, where health education and practice on how to stay healthy can be some awareness can be brought about in patients and in general public, faculty, students, and overall all. Some counseling services and integrated healthcare also can be promoted through these counseling and wellness centers. Next slide, please. So finally, the resources and resource material. So to begin with, we have a lot of resources And for implementing UHV and holistic human health workshops in our institutions, resource persons, training by trainers, all the resource material are already freely available. Holistic Human Health book is available, a foundation course on holistic human health, its philosophy and practice. It's a ebook freely downloadable by all through the UHV website, uhv.org.in. We have a lot of books, videos, and other resource materials also, which are freely available on our website, and they are freely downloadable also. Audios and videos are also available in the website. Self-exploratory exercises on observing self and body, and sharings by participants of who are attending morning sessions and who are doing the self-exploration. So that is also available. Other support material that is available through regional coordinators of UHV Pan India, and nodal centers also are there throughout India to help this implementation. So with this, I would like to end the briefing. So I hope it was the briefing. From the briefing, we could have got some idea about the implementation of holistic health. So let's move on to the panel discussion now. So hope all are ready for it. So as after listening to the 2 days of these panel discussions and listening to the SWOT analysis part and the vision part and today implementation, I would like to know from our panelists here. Firstly, I would like to know from Sundar Raj sir. Sir, what is the possibility you see of implementing this in your through your workshops or through your Arogya Dhatri Foundation organization? So what is the possibility you see, sir? I would like to know from you.
Thank you, madam, for giving me this opportunity. And this is the most important and interesting aspect. And I think my life's mission is to take holistic human health to the and into the education system and also to the general public. So till now, we have conducted 29 holistic human health 7-day free workshops. So whatever we have written in this book, we are just teaching the same thing and also making them experience this. It's not just giving them the theory part. 7 days we are teaching this, and then we are also asking them to use the health tracker. We are giving them accountability partners. We are tracking their health tracker, and the results are simply amazing. You know, we are not treating, we are not giving any medicine, we are not asking them to, use some specific, regimen, or also just we are teaching them the health principles, and we are asking them to design their own lifestyle based on these health principles. We are not giving any prescription of a common lifestyle for everyone. We are making them understand their own mind body type. Then we are giving them this what we call guidelines, and also examples with which they can understand how to design their own lifestyle. And this is very successful in my opinion, because many people, though they are not taking any treatment, just they are following the health principles. They are saying that they have successfully stopped using insulin, they stopped using diabetic medicines, hypertension medicines, and pains from so many years they got rid of the pains, and so many things which this is the one aspect where we do this for general public. But recently I'm going to more and more colleges and schools where I'm trying to teach the children. There we have a problem because we get limited time with them. We get a very few hours where we can just put the principles forward. We need to help them experience it. Like in our in our place, we do a what we call the as residential workshop where they experience. Luckily, recently we are also doing these sessions in schools where we are getting permission from the RDO, who is allowing us to do some practical sessions for the children also. And the children are responding wonderfully. Uh, in fact, today I did one session in my school, and the RDO madam was present all throughout the 3 hours of the session, and we did so many practical things. And she has agreed to supply all the 300 children with bamboo brushes instead of toothpaste, tooth powder, and so many other replacements which we have suggested. She's agreed, and the children came forward. They said, "We will purchase. Please give them." They are happy with the substitutes which we are proposing. So unless and until we inculcate the practical aspects, if you only teach them theory, they might not experience it. We made them experience. Luckily, in the hostels, they brought the toothpaste and shampoos, and we read out the chemicals which are present in those things, and they're so shocked, and they want to change. So, principles and practical guidelines, this is something which we need to do, and the education system is the place where the entire thing is possible to build a healthy society. And I will try my best to do this, madam, and I'll also try to share my experiences. Thank you.
Very nice, Sundar Raj sir. Really liked the health tracker part and the bamboo usage instead of the normal toothbrush. So very nice to know.
There are so many substitutes for everything.
Yes, yes,
Substitute for not just the toothpaste, for soap, for shampoo, for the dishwashing liquid,
yes,
and liquids to wash the clothes, to clean the floor, to everything we have substitutes. And here the idea is not just not putting toxics inside the body. When you are putting toxics in, you are also putting toxics out. When you are using something which is riddled with chemicals, we are also pushing them, pumping them into the rivers, into the earth, water, river bodies, everything, it is getting polluted. So when you are living close with nature, in tune with nature, you are allowing yourself to be a part of the solution, not the part of problem. So
yes.
thank you so much.
Thank you, sir. Thank you very much. Next, I would like to ask Nilanjan Datta sir. Sir, what is the possibility you see implementing this holistic human health vision in your institute, sir?
Ma'am, actually, we follow here NEP 2020 National Education Policy. So there, like we basically support the student-centric approach here, and there I like there are several implementation of holistic uh, approach. Like in physical health, we see there we have to implement how we will implement that, like balanced nutrition. So then there'll be screening of the student, diet checking, and diet plan giving to the student, and regular physical activity, yoga. Yoga classes for then we provide, like we have to tell the student, and we are telling the student to adequate sleep. So they are so much addicted in mobile phones and the reels at also their lack of concentration. So in like 1 hour or 40, 45, 50 minute classes, they are unable to concentrate. And so this because of the reels. So they like in interesting reels they will watch. So 20 seconds, and from there, if they are interested, they will watch. Otherwise, they will skip. So there are things that also improve the concentration. There will be like we have to tell them to meditate and connect to the nature. And then next will be the mental and emotional health we are see looking for. There we can tell the student like uh, we can tell the student like positive self-talk, and like relation, workplace or classroom, friendship building, and sharing the thoughts to the friends. And even they can share the like emotional burden to the teacher also. We allow that, and we emotionally support them. And next, in case of social health, we can like tell the student to healthy relationship with family, colleagues, and community. Like we are having camps, so community workshops. So we are taking the student to the society and educated the villagers and health related issues, emotional and psychological problems, stress management. So that is the social health. And next, spiritual health. So spiritual health, like some people are religious or not religious, that is different matter. But we suggest the student like prayer and meditation and spiritual practice and mindfulness and self reflection will be helpful to maintaining our stress. And next, environmental health. If you see now, we need clean air. So nowadays metropolitan cities is too much polluted, and there will not a clean air. So in between, like who all are in city area, so I feel that they should go some clean and fresh air for like a trip, educational trip, or and water and sanitation, new like fresh air will mind will be changed. Like then self living a working environment, that will help the changes. So this is the from my side. Thank you, ma'am.
Thank you, Nilanjan sir. So you have told so many things, what all can be done. I just want to know whether UHV is there as a course for your students?
No, ma'am, we don't have UHB course,
Okay.
but uh, in a national education policy, there will be the student-centric approach, and from there, like there are several type of teaching methodology we are following. From that, like we following little bit of
Okay.
holistic health.
If possible, you can propose, I feel, if you see a possibility, because you have seen the advantage of having UHV or holistic human health. So it's such kind of courses, if introduced, it will be useful for the students. So you can see for the possibility of including this in the curriculum for students.
Okay, sure, ma'am.
Okay,
Yes.
thank you, sir. Thank you. Next, I would like to know from Sujata ma'am. Ma'am, am I audible, ma'am, to you?
Yes, ma'am.
Ma'am, I would like to know from you, in your institute, what do you see the possibility of including holistic human health course for your students, or some FDP for your faculty members? How you are looking forward for it?
Yes, ma'am. Regarding this holistic human health, we are actually having food science department in our college. So this food science department used to give the nutritional advice to the students, and they'll be saying about how the natural colors, natural ingredients can be taken from vegetables. Like that, so many items they used to do, and they used to come and sell also. So when the people are coming and buying their products, they'll be getting surprise. From this vegetable, you get this product like this. Like that, they'll be surprised, and they used to take also. And in the nearby villages also, this food science department, they used to go and advise regarding the nutritional health, how the people have to take care of their health. Because it's completely rural area, so they'll be going, they'll be giving the advice to the people, and the people also very much interested in listening those things. And another practice what I did to the students is, as Mr. Nilanjan said regarding the mobile addiction, I informed the hostel students they have to keep, they have to give the mobile in the morning by 9:30 p.m. and morning they can get by 5:30, because this time they have to have the proper sleep. So they should not wander here or there. Earlier times at the very first stage, I received many dummy mobiles from the students because they are not interested to use the mobile. And later we used to catch the students, and we are finding that they are having the original phone in their hand, and we found it and we got it also. So such challenges we faced also, and we are having a practice of conducting the mentor hour for the students every week. So during that mentor, the students will be coming and telling about their own practices, what they are following, and they'll be giving some suggestions also. So through that also we are giving advice to the students. So we are conducting the value education as a subject also to the student. So through that also we are guiding the students, and we are taking the students outside as usual in all the colleges what they are practicing. So through that also we are educating. So maximum skill oriented programs only we are conducting. So the students are getting enriched through that also. So these are all a few things about institution we are practicing. Thank you.
Very nice to know from you, Sujata ma'am, and that idea of yours is very nice for hostelers taking and keeping their phones after 9:30. So this will also be like we are helping them out because in this age students may not understand, but maybe by force also if you are making them to do, it will be useful for them, and later on they will understand the advantage of this particular thing. Very nice, ma'am. Very nice. Thank you, ma'am. Next, I would like to listen from Swapan Chanana, sir. What is the possibility you see in your institute, sir, for promoting holistic human health and UHV?
Greetings of the day to all. Yes, I am very fortunate that in my institute, we belong to Ludhiana, Punjab. So this Punjab Technical University is one of the first universities to implement this Universal Human Values course. It's already being implemented, means UHV2 course is being run practically in every course. So right now in this semester also there are 25 sections of around 60 students each is being taught. And the best part about this UHV course, what I think is that, like Dr. Sundara Rajan was telling, that prescription will not work, especially to these youngsters who are very logical, right? So and we have means last 2 days also we have seen that it is a process of self-exploration by which I think this education is being forwarded. So even when I go to the classes, because I have been teaching this, and then when we keep it in the form of the proposal, and then we get the answers from them, means whether it's you want a relationship or what is naturally acceptable to you, and when the answers, because it's all these courses are on the reality based, so it's universal. So answer comes universally by all the students, and then we move forward. So in this way, I think the format of this UHV course is very nice. So in the same breath, I think now the next step, I think the holistic health is also a part of this UHV because it's a holistic course. But I think last 2 days it's an eye opener that the way the health means we all have to work on that, otherwise it will not be sustainable, and the issues with the youngsters like mental health and all, that's very serious concern. So I think already in my institute the UHV has made some base, because now we have a team of around 15 to 20 teachers who are already teaching this. So they are also being trained by having a lot of workshops which are being conducted by our AICT and Punjab Technical University. So in the same way, I think now it's like holistic human health, I think it can be a full-fledged course, because I think now the practice part, the best part, like when Dr. Sundarajan said that prescription will not work, I think in this the practice part will be there, and in that I think we will get again the guidance like you have already shown there in the way, like the first week, the step 1 we can start with the workshops again to train the teachers. That is very important because teachers have to practice it, that's very important, and then we can start with the course with the students, and then even I think we can go for the holistic centers to serve the society also. So I think this is from my side. Thank you.
Thank you, sir. Nice to know that you are already having UHV in the curriculum for students, and also you are uh, thinking of conducting workshops and for students as well as faculty, and you have a plan for wellness center also. So that's very nice to hear from you. Let us move on and let us hear from Aditi Parekh. Aditi Parekh, ma'am, uh, can you tell what is the possibility that you see in your institution where, uh, or in naturopathy, what you see the possibilities that we have of implementing this holistic human health?
Namaste, Shrija ma'am. Namaste, everyone. What I felt on a personal level, I can share that. And what is the possibility in my center? What I see as is when I pursued UHV, I have attended 2 batch of morning sessions, and I'm doing exercise 1 and exercise 2. When I did it regularly, what I experienced is that my behavior towards my surroundings and towards my patients changed, and whether they get rid of the disease or not, but they will have a lifetime connection with me after going from the center also. What I experienced is, and what I experienced in myself is, previously when I used to do less work also, I used to get very much tired. But with the feeling of relationship when I'm doing the work with the patient, I'm not getting tired. When somebody used to ask small questions to me, the patients used to ask how this treatment will affect my disease, I used to get irritated by them, that I'm doing the treatment, I have the knowledge, why you need to disturb me? But when when they ask me now with the feeling of relationship, I'm able to explain with love, with affection, and with affection I'm able to treat them. So this is the change I have experienced in me. In my staff also experienced that my way of doing treatment is different, so they also learn from me. Sometimes people try to copy the way I speak to patients, and they ask me also that, because in medical line, what I don't know about allopathy or something, but what we have been taught is you should always have a smile on your face. Whether you are irritated from inside, you are angry, you should always have a smile. So I was taught this before UHV. From inside, I used to get very much bothered that I am bothered from inside and I have to smile outside. So it used to get very much difficult for me. So every student used to think that she's acting, and she's acting very well. So they would ask me, how do you act so well that you are smiling all the time? But when I introduced some of them to UHV and they also got to know about this, then they got to know, okay, you are smiling from inside, you are not acting. So this is the change my surrounding noticed in me, and I have noticed in myself. And about the center, right now I am not working in any center. I'm taking online yoga classes by myself only. uh, I used to work in Patanjali. I worked in Patanjali Center for 1 year. Now I am doing it on my personal level. So actually, I don't have much information that how professionally we can implement it. But personally, I have implemented in my life, and I have seen tremendous magical results, which I never thought. So thank you so much.
Very nice, Aditi. Following naturopathy or natural behavior, and it is having its impact on others. Very nice to know this from you. Thank you. Next, we like to hear from Vidya ma'am. Ma'am, welcome. Will you be able to talk, ma'am?
Yes, yes, ma'am. Yes. Sorry. Actually, it got delayed. I thought I can arrive early, but it got
Okay.
delayed. Sorry for for that.
Okay. Okay, ma'am. We are
Great.
having a discussion. I'll just give in short about what we are discussing.
I think
We,
I can answer the question, ma'am. I
okay,
think
okay.
how we are going to implement the holistic human health. I
Yeah,
was listening to the
possibility.
others. I was listening to the others. Hope I can answer it.
Yes, ma'am.
Like
Yes, sure.
very warm greeting to one and all over here. Right. I now right now I am a part of two institutes simultaneously. So I am working as an assistant professor in the Department of Anatomy at JIBMAR, which is a central institute. And I am owning my own institute. I'm a secretary of Sri Pasco Group of Educational Institutions at Tamil Nadu. So we do have nursing courses and pharmacy courses. So when thinking about implementation of holistic human health in JIBMAR, it will be different. So actually, we are almost having all those things. We will be having separate yoga classes. So this yoga center is being attached to the Department of Physiology. So every week, students will be having compulsory yoga classes. They have to attend. They have to go and attend all those things, not physical activity. And also, we are having a separate session for faculty also. So those who are willing, they can come and attend the yoga sessions. So this is one thing. For the students, for managing stress and all, we are having Zumba classes also. So monthly, twice or thrice, we will be having Zumba classes. So mainly, we are focusing on health, like other physical activity, because to come out of this psychosomatic disorders, so they have to come out of the stress level, because like medical college, though students are very active, they'll be having a pressure always over their mind. So we thought like all these physical activities would help them. And we do have nice outdoor stadium, and we do have this NCC programs also over there. So yeah, we often have a cultural meet. So all these mainly focusing on the all these dance, western dance classes also we do prefer. So there will be a student recreation club for the students in the gym. So this is one side on the government aspect, central government aspect. So in my institute, nursing students are there and pharmacy students are there. So what we have done in our institute is like we have promoting gardening now. So we have enough space around us. So we will be allotting a small space for the students. This is also mainly to encourage the physical activity. So each place will be allotted to the student, and they have to plant whatever they want. They can do cultivation, or they can develop that into a garden. According to their own creativity, they'll be doing something in the place what is given to them. So this is one aspect, and we have regular health checkups, health camps also will be there, and training purpose and all these things we are doing. So we are trying our level best to implement this holistic health throughout. So I think these are the things right now I'm able to do.
Very nice, ma'am. You are
Mm.
traveling and you could
Uh,
talk with us and share
yes.
your views. Very nice, ma'am. Thank
Uh,
you. Thank you very
thank you.
much.
Thank
You
you,
are
everyone.
already doing a lot.
Yes, ma'am.
So I think already you are in the path of implementation.
Yes.
Nice to know all these things from you.
Thank you, ma'am.
Thank you. Thank you
Thank
very
you.
much, ma'am.
Mm.
Next, we would like to hear from Shobit. Shobit Raj, am I able to reach you? Shobit, what are the possibility that you see in your institute, how this holistic health, you being a medical student, what do you see the possibility of this implementation in your institute or in your college?
Yes, ma'am. So implementation of holistic health in a college, ma'am, in a college, students are not just learners. They're young adults navigating many things such as stress, expectations from their own selves, and uncertainty from the future. Implementing holistic health in college means that we take care of the whole student, not just their academic scores. It begins most importantly with physical health, safe hostels, nutritious and affordable food, and access to medical care, opportunities for sports, yoga, and daily movement. A healthy body supports a focused mind. Ma'am, mental health is also equally important. Students deal with stuff like exam pressure, anxiety, burnout, and loneliness. A holistic college provides counselors, peer supports, and open conversation that normalize seeking help instead of suffering silently. Holistic health also includes academic well-being, supportive faculty, mentorship programs, balanced schedules, and a culture that reduces unhealthy competition that helps students. Ma'am, beyond classrooms, colleges must support emotional and ethical growth. Uh, involving clubs and cultural activities. Ma'am, when a college truly implements holistic health, it does not just produce graduates, it shapes healthy, balanced, and responsible human beings.
Nice, Shobit. Nice to listen as a student how you are seeing the importance of health. And being a medical student, obviously, if you understand these things, you will be able to guide many. That's what we can see. So now I would like to know from Sundar Raj sir.
Yes,
Sir,
madam. Yes.
uh, sir, what do you think? What are the challenges if we want to implement this holistic human health? What do you think will be the challenges that may have to face?
Yes. So, like, there are so many challenges, madam. So, first thing is to train the faculty. It is a very difficult task because it's not just holistic human health is not just we give some theory and ask them to repeat the same thing there. Unless the faculty implement the same things in their life, they will not be able to properly communicate the same thing to the children. So training the faculty itself is very difficult. Make them experience and understand the universal health principles and put them into practice. It's very important. And again, uh, holistic health speaks about so many things. It's not just practicing yoga, practicing some physical activity or something like that. It is enabling the self with enough knowledge to take good care of both self and body. Okay, so that knowledge right now is it's bits and pieces, and there are so many controversies, so many things, myths and other things which are spreading so fast. So it's very important to separate facts from the things which are spreading and give them the right information and also let them experience. The thing is, in the institutions, if you just put on some facts before them and if you don't let them experience it, they will never be a part of their lifestyle. So not it's like if like sir has rightly pointed out that their university in the Punjab Technical University already UHP is there. That is the place where we can start a practical exploration of holistic human health principles. Similarly, in different institutions where there is a space where the students can experience everything practically, not just listening to the principles and following the guidelines, putting them into practice, and then if they start getting the motivation from inside, not from outside, the inside motivation will give self discipline and they can design their own lifestyle, they can do it on their own, then that will go forward and it will live with them forever. So that kind of transformation is not so easy, but with consistent and persistent efforts, I think it is possible. And luckily, in our institution, I can proudly say that an entire 40-bedded hospital is chemical-free hospital. Whatever is coming out of our washrooms and hospital, it is nourishing the earth, nourishing the mother nature. Similar institutions can be replicated everywhere. Similar mental state can be replicated everywhere. It is just thing. And sooner or later, people will understand, and people will definitely start working towards and implementing towards the holistic human health implementation all over the world. That is the only way. There is no other way. Thank you.
Yes, sir, Sundar sir rightly said this is the only way. No other way is available. Okay, very nice, sir. So next, I would like to listen from Amipara sir. Amipara sir, can you tell what are the challenges you see in your institute if you want to implement holistic human health? Amipara sir,
Yeah,
what are
this
the
is a
challenges you see?
really
Yeah.
the challenges part is a really very important question because first of all, any new thing is to be implemented. That means we have to start with the mindset. mindset of the people. That is the biggest hurdle and first challenge. So you need to convince at every stage. And when I talk in terms of challenges, anything new is to be added, then major way we have to consider three aspects: a human, time, and finance. When you talk about the human, that means the resource persons. We need to train a resource person. First, we need to convince the management, then train a resource person. If you are at the principal level of head of institute level, then probably one step less. As a staff, if you start, then you have to convince the principal, convince the top level management. So that is the biggest hurdle. Then next hurdle is time. Even resource person is also a hurdle, because generally people would like to stay in comfort zone. Nobody would like to take extra burden. Always people will say, I am overloaded, I have a lot of load, how can I accommodate, etc., etc. So at every stage, we need to go on convincing, need to go, and best part of convincing is to explain about the benefits, about the our duties, our benefits, what are the good things. Based on that, you go on convincing, and then next thing comes is a time. You need to have a time slot which is to be added in your curriculum, and to train the people, you need to have finance. Then you may need to have some resources things. Let's say there are resources available, books are available, literature is available, but especially in a different region, people would like to have a study in a regional language. Then we need to convert into a regional language. This is it's also a big challenge. So these are the major challenges. Then the resistance from the staff is this a challenge. Then high pressure, overloaded people is a challenge. And then another issue is lack of a trust. When you are first time implementing, everybody will not have full trust that whether this program will it get succeed or not. So, and especially in a private institutes, change of management is a big hurdle. The moment upper level management gets changed, decision gets changed. So these are the some of the major challenges, apart from the wellness center establishment challenge. There again, you need to have an expert who can really advise for a wellness of the people. So these are the some of the important challenges we need to take care. Thank you.
Very nicely said, Ami Paraji. You have told about people, time, and finance, which are some of the challenges you see in your institute for implementing this. Next, I would like to know from Sujata ma'am. Ma'am, what is the challenge you see in your institute, ma'am, for implementing this?
Yes, ma'am. Actually, I'm listening to Dr. Amipara sir. So what I thought of saying, he actually said many points. Like the first challenge is from the management side. Because if we have a thought of implementing certain things, the management may not actually accept the things. What is the way we are trying to implement? So again, it is the time factor. Because, currently in our college, the timing is morning 8:50 to 1:30 for the students, and for the faculty it is at 4:40 p.m. So by 1:30 the students will be winding up and will be going home. Some of the students are working in the afternoon session also. That's why we are practicing this thing. So if we are going to say the student have to follow like this pattern, this exercise you have to do like that. Means the students may not do. In front of us, we are making them to do. We quite good. They will also have practice, and it may become a habit in future. But all these things come into a single time or something means it's a challenge for us. Actually. What at present we are doing is some students, if they are doing mistakes, knowingly as well as unknowingly, if they are doing some mistakes purposefully in the college, they are giving a punishment to make a garden. They have to sample a tree or something, and they have to pour the water regularly. This is the punishment to the student. So one way it is actually making the tree or something to grow. The other way it is exercise for the student to do this process. So certain the current in this current generation, certain things we can't implement directly towards the students. Indirectly we have to, and indirectly we have to implement. Then only the things will get full-fledged, and then the things will get complete also. So in such a way only we can proceed with the things. So the challenge currently in the place is the management and the time and the way how we are going to proceed with it. So it is really a challenge for us, but we have to do it. So I'm actually requesting Dr. Sundaraj sir to give some tips. Suppose in the morning session, when they are entering into the class by 8:40, the session will start by 8:50. So 10 minutes, 15 minutes, what student can do to keep their mind and to keep themselves fresh that half a day session. So if you are giving some tips, I'm ready to implement so that to certain level it can. So that is what I'm having thought. So I'm requesting Dr. Sundaraj sir to give some tips also. So this is the challenge. Vijay ma'am, thank you.
Yes, ma'am, rightly said. Management in institutes is a big challenge to convince them and make them understand the importance of this. Really, we have to work hard in that direction. And for as far as students are concerned, to make them to understand the importance, again, that's also a challenge. Rightly said, ma'am. Now, I would like to know from Kriti Sharma. Kriti, I would like to know from you. You are an MBBS student. So, can you tell me some of your commitments after listening to the importance of implementation of holistic human health? I would like to know from you how you can tell us about your commitments in this direction.
Ma'am, so UHV modules have already been introduced in our college, and it has been very helpful because, especially being a part of the healthcare system, I think UHV not only provides us the right understanding, but it also helps us to guide others in the same direction. Because somewhere we are able to find the root cause for a lot of diseases that we are working with every day, the rise of a lot of psychosomatic diseases that we have discussed. So I feel that in that direction, personally, my commitments would be finding more time for this self-exploration that we talk about in UHV, and then also trying to find peer groups that can allow more elaborate and open discussions about these things. Because I think largely the UHV module is designed as a discussion, as something that you explore and elaborate upon to reach the natural acceptance rather than a lecture. So I feel it needs a continued addressal all across colleges, all across different disciplines. I think that is something we should implement to make a better future for everyone.
Nice, Kriti. Nice to know that from you. Now, I would like to know from Swapan Chanana, sir. Sir, can you tell us about your commitments in this direction?
Good evening once again. So I'm very fortunate that the top management in our institute is very supportive of this UHV course. But then still there are challenges like Dr. Sundarajan said, the trained teachers Means already means we can't blame them also because they're already overloaded with their own courses also. So in that way, the challenges are there. But then once you are committed, because if I see myself, last 5 years I have been into this UHV self-exploration process, and really these morning sessions, I want to tell, they are really helped me a lot. So I can see in my life also, like I was also facing these stress issues, and the headache was a constant part of my life. But then when I started doing this self-exploration and right understanding, the harmony started coming in the self, and this now I'm much better. And then in my family also, and at my institute also, my relationships have become very lot better. And people also are saying that okay, now you are a changed person. Earlier your behavior, and now, and I, the best part is I can check for myself what I was and now what I am. So in that way the commitment is 100%, ma'am. So and then when I go to the classes, again the students, that also is a challenge, but then again I think trained teachers, means we all have to, means the commitment is this, like Punjab Technical University has already supported us for having a lot of workshop, AICT is also supporting. But then I think the pharmacy, the best news is even the Pharmacy Council of India has now implemented this UHV course. So the next session, that is also starting. And now I have a pharmacy department, so I think I can take their help for this holistic human health, because they're already talking about all this, but then it's again bits and pieces, like Dr. Sundarajan said, now the practice has to come, I think. Then again, so I can, again, the commitment is 100%. Like UHV has showing the path, means it is bringing changes in the campus, and the students are also able to see the importance of that sooner or later, means they realize it, because you have to be persistent, because when you go to the classes, and if you are persistent, you have patience, and I think the results have shown in this UHV, and I'm 100% sure that in this holistic human health also the same results we can bring. So that is the commitment from my part. So we will do everything to implement all this, taking the help of all the, it's a teamwork. So talk to the directors and this pharmacy department, I think we can collaborate and take this holistic human health course very seriously. Thank you. That's all from my side.
Nice to know that, sir. You are an example. You have followed this UHV principles, and you have seen a change in yourself in as far as your health is concerned. So that's very great, sir. Now I would like to listen from Nilanjan Datta, sir. Sir, what is your commitment, sir? So what do you think? How you can take this forward?
I should tell my management to follow these things because they not aware about that. So basically, I feel the most challenges is that lack of awareness and understanding. People don't know about that holistic health approach. What is that? And if they know also, they are not accepting. So make them understand is very difficult. So okay, I'll try my best, and this is my side to make them understand. So I'll try. Thank you.
Okay, nice, sir. Next, I would like to ask Amipara, sir. What is your commitment, sir, for taking this forward?
Yes, I'm committed to work for UHV and working already for that. In fact, in our institute, we already have had a workshop. We are running SIP, introductory we have done, UHV 2 we have done. And we are running a student forum. They are taking care of the UHV part as well as the health part. Now, senior students committee, they are deciding about snacks, food, etc. And they are always preferring healthy foods. So they are working on a mess, they are working on a canteen, they are working on a routine, morning exercise, etc. Only, of course, it's a big challenge that every time you have to select the students. because normally final year students are doing this, and every year they will go away, the new students will come. But it is possible. So that is already we are doing. I'm thinking that one workshop for human health, which will give a good insight. Also, informally, we are running a wellness center. I'm planning to strengthen the wellness center more and more, so that people can have a awareness, more and more awareness. Of course, it is financially, it is not at this stage probably feasible. Otherwise, we can have a AI operated integrated wellness center, which can really keep data of people, and then we can have a more. But it's a part of a future, and already we are planning to have a societal awareness center. Again, it's a combination of a senior student and staff. Go among the society and make them aware about the health. And still one more part, of course, it is at a very early to say anything, a very at thought level, that what we call a Garbha Sanskar. I am trying to talk to the gynecologists, some of our local gynecologists, and what can be done on that. In my mind, there are two things. Number one, we can have a workshop, UHV as well as a health workshop for pregnant ladies. Especially something like a pregnant lady having four or more than 4 months. It's not at the fetus level, it is at the child level. Even they listen the workshop, they listen the what are the things. Then also it we can say as a Garbha Sanskar, it will imbibe into the child. And number two, how the progress within the womb of the mother can be monitored. Of course, we may need an instrumentation, but this is at a thought level. So these are my ideas and my thinking, and let's see what can be done. I am committed for that, and I'm sure one day this will be done. Thank you.
Yes, good to know your plans and commitments. Next, let us hear from Vidya ma'am. Ma'am, what are your commitments for implementing holistic human health, ma'am?
Ma'am, as I told you, I would like to say two things. So in my government institute, one of the program which is very useful for us nowadays is this Karma Yogi program. So central government has launched a new program called as Karma Yogi for all the central government employees. See, actually in that platform, we do have plenty of videos which will be very useful for us, which is a certified courses. So in each course, they will say all valuable things. Say, for example, we do have courses on harassment, women harassment, sexual harassment, how to handle, what are the law against it. Likewise, we do have separate courses for health. There is yoga at the break in the workplace during the break. So in that, they will teach us how to do physical activity, how we can engage students in physical activity, cultivating this holistic human health. Even at our workplace, one short duration of break, that is enough for us to make physically active. So like that, there are plenty of courses. So what all the yoga things and what all the other physical activity can be done, and how holistic food, say for example, the nutritional value of food. As I have told, for pregnant women, there is a separate courses. So if they attend that small, it will be like a video thing, short film. It will be like a short film. So at the end of the video, we will be having some questionnaires, and if we are able to answer the questionnaires, we'll be assessed, and then we'll be getting a separate certificate. So what I think is, like, if UHV can be incorporated in that platform, automatically it can reach almost all the government employees. So that is one thing can be done, but it needs many planning and approval, progress, and all the other things. But in my private institute, as I told, this pharmacy council has approved this UHV. maybe next year in our curriculum, we will be implementing all these things. So in private management, what we face main challenge for us will be the financial burden and the human resources. So financially also we should be able to provide everything that yoga classes just like that we cannot start. So activity, physical activity, if you are saying we should have a nice outdoor stadium and we should have a nice place to for this yoga exercise, doing this exercise. And we need actually some financial support also. So that will be a biggest hindrance for us in private management. But still, when it has to be implemented, we will be finding some way to overcome all these things. And in our institute, we are planning to conduct some workshop like things. And on and off, we will be having some role play and a short video contest, mainly of health theme. Like most of my hostel students have avoided the junk foods because of the things. So that is very happy for us. At least a few are going to change. From then, others can also will be changing. So these are the small steps we have taken towards holistic human health. But as a course, we want to implement. We are trying our best to do that also. Thank you.
Very, very nice, ma'am. Already you are doing a lot of things. So good to see that a positive approach is there. We all are able to agree to this. And now I would like to know from Shobit also. Shobit, what is your commitment regarding this holistic human health?
Yes, ma'am. My commitment to holistic healthcare in my college. So, ma'am, as a medical student, speaking from my side, my commitment to holistic healthcare is centered toward action, not just awareness. I believe that holistic healthcare must be practiced within the college before it is preached to patients. I commit to supporting the integration of physical health, mental and emotional health into everyday college life and promoting regular health checkups, wellness activities like yoga and exercise, and healthy lifestyle practices amongst my peers. I will actively work towards strengthening mental health care by encouraging peer support systems and advocating for safe spaces such as clubs where students can openly discuss about their stress, their emotional burdens, and burnouts. I also commit to promoting holistic healthcare to patients and care holistic healthcare training in patients by encouraging empathy and ethical decision making. Ma'am, through student-led initiatives, most importantly, health camps, awareness programs, and collaborations with faculty, my main aim is to build a college environment where holistic healthcare is practical, visible, and sustainable. As a future doctor, I see holistic healthcare not as an add-on, but the foundation of effective humane medicine. And my journey to implement it begins in my own college. That's all from my side now.
Nice, Shobit. Looking forward to see such youngsters becoming holistically aware and following this in the medical profession. So that's very nice to hear from you. I would like to hear from Aditi also. Aditi, what are your commitments?
Yes, ma'am. I see some things which I can implement as a in my personal life. Like it's been addressed that I have to implement first in myself to make an environment like that. So what I see the challenges in me first is my preconditionings and my pre-assumptions. So I'm trying to observe them as we learn in exercise 1 and 2 in morning session. And then I see some challenges, like if we try to implement these UHV exercises or things in naturopathy centers or something. Nowadays people see naturopathy as a business, so it is very hard to convince them that these things can be implemented, because they see naturopathy is a cure of body. So the self is not in their imagination, so it is very hard to convince them. So on a big level, I see these kind of challenges, and on a personal level, what I see is that our families and our societies expects us to earn a lot of money, but it is really hard to convince them that the self is different and body is different, the needs of body is limited, and I need to earn according to that. As I see in my life also this challenge that always society and people judge me according to the money I earn. So this challenge I face in my personal life, and on a big level, as I said, people see everything as a business. In medical line also, people see it as a business. So it seems very hard to convince them, but I think that as it is being implemented in my life, people are seeing changes in my relationships. It is becoming easy to uh, to to convince them because they are seeing the changes. So these are the challenges I see and I am facing. This is my take. Thank you, ma'am.
Nice, Aditi. You are doing your part. Let us be in the journey and give our participation. That's what we can do. So it was really a very fruitful discussion with all the panelists. And now the forum is, with this we end the discussion, and we open the forum for question and answers. So if any of the delegates or any of the panelists also have some questions, it can be put forth. It can be asked or it can be put in the chat also. No questions?
Any of our attendees would want to pose some questions regarding the implementation, can definitely raise their hands and pass on the mic to you. Also, you can raise it on.
Bindeshwar Prasad sir has put a question. In the digital era, rising stress and anxiety and lifestyle imbalance are driving premature cardiovascular events among youth. Strong evidence supports self-awareness, resilience, yoga, mindfulness. It's a big one. Bindeshwar Prasad sir, I would like you to raise your hand and you can unmute and ask the question.
No, it's not a question. It is like he's expressing his feeling. That's all. He's not
Okay.
asking any question.
Yes, okay, fine. Fine. If anyone else has any question, please unmute and ask.
Ma'am, may I ask you a question?
Yes.
So I would like to, I'm very much impressed by Aditi ji's because genuine exploration, how she has gone through, and Aditi ji really an inspiration for the youth. I would like to ask you, like you said in your journey, so many changes are there at the same time, your friends and others also in relations. So I heard that you were also saying that you are taking classes online. So may I know whether you are your outreach programs, are you visiting any colleges and sharing your, so how is the response in colleges if you visited? Hope I'm clear with my question.
Ji, ma'am.
Mm.
Yeah, I want to make it clear that I'm not going in colleges and taking classes. Actually, I'm taking online yoga classes on personal level. So I treat patient with yoga. So basically, I take personal yoga classes with some of the patients from my previous center and some other patients also. So I have not taught in colleges till now.
Thank you. Thank you so much. Ma'am, may I ask another question?
Yes, ma'am.
Yeah. Sundar Raj sir, Pranam sir, it's very nice that you are organizing such a wonderful wellness center and all already whatever is proposed here. Could you please help us how, as a faculty in our institutes, uh, can propose these, like how we can motivate our students also?
Yeah, like I strongly feel that
Mm.
you first initially you can invite people who are already doing this and ask them to interact with students, discuss the universal health principles, and also explore the possibility of they trying this in their own life. So once this happens, students will themselves ask for more. And the beauty of holistic human health course is it is all evidence based, backed with science. Whatever we are proposing, we are backing it up with lots and lots of scientific research. If you look at the holistic human health book, it is filled with lots and lots of references from modern science research, publishing and other things. So it is very easy for us to convince the students with this science backed evidence. And once they are convinced and they start putting it into practice, they'll experience it, and then there is no going back. So all we have to do is start. You know, there is no other way. Right now, in our Visakhapatnam, like there is 2,000 acres of land is being given for building hospitals, and each hospital is like a huge palace. And there are thousands of beds in each hospital, and still there is no vacancy. Lots and lots of patients. They have to wait for 2-3 hours to get an appointment for to wait. To even after getting an appointment, they have to wait for 2-3 hours. So we can see that even though the medical infrastructure is developing so fast, the health of the society is deteriorating at an equal pace. So the only way is to enable each and every individual with enough knowledge that they can preserve their own health. They take this into their own hands, their health in their own hands. They can form a Rakshana Kavacha around themselves, around their family, so that they will never become patient. They will become part of the strong society, healthy society. And the first step is to conduct, at least initially, we can start with online sessions. I personally felt that whenever we went to colleges and started speaking sense into them, like practically, without preaching a lot, asking them genuine questions and evoking, getting genuine answers, that picked their interest, and they are really interested to go deeper into this thing. Because holistic human health is not, no, previously we were discussing that it is not so easy to develop faculty, but even the faculty members, everyone's need is health, no? So if they want to teach this, they need to experience it, and everyone needs health. So
True,
it is
sir.
our responsibility to just take it forward, make it a movement. As we have done with the UHV, we have to do the same thing with holistic human health, the
True,
same
sir.
thing.
Thank you so much, sir. Thank you so much for the detailed answer. Thank you so much. Thank you, ma'am, for the opportunity. I thank other panelists also for your inputs. Thank you so much.
Thank you, sir. Thank you, ma'am, for the good question and rightly answered by Sundar Raj, sir. So we just let me give a quick summary of what we had discussed today. So we have seen all the possibilities, challenges, and the ways to overcome this process of implementation of vision of holistic human health in the education stream, so that it reaches to the youth. The knowledge, it should reach the youth, and youth should take the responsibility for their own health. And we discussed about each one of your individual commitments in taking this forward, and it was really a very enriching session. And we come to the end of the 3-day panel discussion. So thank you so much to all of you, to all the panelists who have joined for all the 3 days, and for sharing your knowledge, spending your time with us, and efforts and your commitments. So it means a lot. Thank you all for the commitments. So taking this forward in your particular institutions and organizations. Thank you for being present here. So with this, I conclude the 3-day long panel discussion on SWOT analysis, vision, and implementation of holistic human health. Thank you to one and all.
Thank you.
Thank you, ma'am.
Thank you.
Thank you.
Thank you so much. Thank you, ma'am.
Thank you, everyone.
Namaste.
Thank you.
Namaste,
Thank you.
everybody.
Thank you,
Thank you
everyone.
for joining.
Namaste.
Thank you, everybody, for joining, and definitely everyone can join for the other sessions that are going on in the various rooms, as well as we are having the closing session at 12:15. Do join. Thank you. Namaste.